Osteoarthritis is the most common type of arthritis, and you can think of that as kind of the wear and tear arthritis. Maybe someone's knee wears out and they need to have a knee joint replaced. So we see that type of arthritis in joints all over the body. Rheumatoid arthritis acts differently than osteoarthritis, and we see it attack both the left and right side at the same time. For example, a person with osteoarthritis may say, oh, my right foot hurts from an old sports injury, but maybe a person with rheumatoid arthritis would describe both feet hurting, left and right hurting at the same time. The two things that physical therapy can help with a person with that type of condition is, number one, exercise will keep the joints moving. One of the unfortunate things is as time progresses and the joint degrades, it'll become less flexible, less movable. So we want to have a person be able to keep moving and keep what we call their range of motion available. But the key is, like, as a therapist, I teach a person just to be gentle. Don't when you squeeze it, it creates more damage to that joint. But you can strengthen it without causing more joint damage. Well, my second piece of advice is find some type of activity that you enjoy that's lower impact. Maybe you like to be in the pool, or maybe you like to do some light walking, but I wouldn't recommend a hard impact type things like running and such. I would recommend a person maybe chooses something like bicycling or something that they feel comfortable with and they enjoy. So biologics have changed what I see as a therapist immensely. For example, as a certified hand therapist, 20 some years ago, I'd see a patient who had quite a bit of arthritis in the knuckles of their hand here, to the point where the joints degenerated, where a physician needs to go in and do joint replacements. After that type of joint replacements, as a hand therapist, I have to create a splint. We do some specific exercises. But with the advent of the biologics, we're not seeing these type of degeneration of these joints, and subsequently I'm not seeing that surgery as frequent as I did in the past. And so it's definitely changed what kind of patients I see.